Today we are going to know about Catscratch disease. So what is Catscratch disease? How is it caused? So usually it is caused by Bartonella Hensley. So yes, as I said, it is caused by Bartonella Hensley. And other than that, how does the patient present with? So usually patient will present with, most commonly is fever is the first symptoms usually patient present with, and also patient will have red papules, which is almost 3 to 4 days of duration, and also most common is localized lymphadenopathy. So where do you see lymphadenopathy? So most commonly cervical and inguinal region is the most common site where we see lymphadenopathy. Other than that, what else you will see? So in this patient you will also see, so usually the patient age will be children's, most common is the children. Also you can see in adults, but it is very rare, but children's less than 14 years are the most common people who will present with this Catscratch disease. So how does it come from? So as the name suggests, cat. So as the name suggests you here, it is cat. So usually you have to ask for a history of pet in the house, especially the cat. So cat is the one which spreads these disease. So usually 100% of the cat feces will have this organism. So other than that, it is also located in saliva, blood, skin, and also claws of the cat. So first is the feces which we commonly see. Other than that, it may also seen in saliva, blood, skin and claws. So important factor here we have to see if they are owning the skin, being bitten by the cat or scratched by the cat or even licked by the cat. So these are the most commonest etiological factor which is responsible for this Catscratch disease. So coming to histopathology. So histopathologically, what do you see? So the most common thing here is granuloma. As I know that you people know what is granuloma. So granuloma is usually composed of epithelioid cells and histiocytes, neutrophils, necrosis and all. Okay, lymphocytes and other inflammatory infiltrates. So epithelioid cells is the most commonest thing. So you will see numerous granuloma in the scanner. So this is the scanner view. So here we can see numerous granuloma. So this will be multiple separative granuloma. Multiple separative. Separative means there will be more inflammatory infiltrate, especially abscess kind, necrosis kind of granuloma. So there are 3 phases. So there is early phase, intermediate phase and late phase. So early phase usually we see histiocytes and also microabscess and also follicular hyperplasia kind of thing, especially in the thickened capsule. So in the place of thickened capsule you can see this in early phase. So whereas in intermediate cell you will see capsulitis and subcapsular granuloma. So whereas in late stage you will see necrosis, abscess and stellate. So what is it? It is often stellate shape or stellate kind. What is it? So usually stellate is, yes. So what is stellate? Stellate is star shaped. So as I said, it is stars. That is why it is called as stellate. So here you can see that there is a star shaped granulomas. So usually we can see this geographic areas of necrosis, and also often outer rim is usually fibrosis. So usually we can see this fibrosis with the necrosis, and there will be, as I said, histiocytes and mononuclear cells along with inflammatory cells. So this is one of the most catchy histological finding which you can see, and you can report it as Catscratch disease. Okay. Here is the another image which is in high power view. So here you can see that there is necrosis and also separative inflammatory infiltrate which you are seeing, and also palisading histiocytes. So these are the most commonest. Always remember, granulomas, stellate shaped with necrosis, abscess and palisading histiocytes. So these are the most important histological thing you have to remember. So this is another image. So here you can see there is proper granulomas. So here you can see proper granulomas along with central necrosis and inflammatory infiltrate. So these are the necrosis with abscess. Yes. So after this, you have to always remember you have to do a special stain. So especially in this Bartonella Hensley, you can see silver stains will be usually helpful to detect these organisms. So what are the most commonest silver stain we use is Wartenstein stain. So here you can see these are the organisms which show Bartonella Hensley. And other than that, another silver stain which is most common is Steiner. So here we can see the Steiner stain showing bacterial organisms. So this usually will be, these two will be positive for these organisms. Yes. So after this, so the most common DDs which we see is the lymphoma, sarcoidosis and Kikuchi and also Kimura. So always we have to learn to differentiate between this and Catscratch disease. So usually Kimura will have eosinophils will be more prominent, eosinophil predominant we'll see, and the Kikuchi syndrome usually you won't see, no neutrophils will be there in Kikuchi syndrome, and sarcoidosis usually will resemble little like Catscratch, but usually you will see granulomas are usually tightly packed granulomas. Okay, so without any suppurative or inflammatory infiltrate, you will see tightly packed granulomatous granulomas. So also lymphoma is the separate entity where we can discuss in other videos. So usually there are different type of lymphomas. So that is different. So usually always keep these four DDs when you are giving as Catscratch disease. Thank you.